Welcome to the hip hinge series, and in the first video we're going to talk about correct technique. The hip hinge is really important because it can help you activate your glutes, it can help you activate your hamstrings, and it can really save the lower back. If you're suffering with lower back pain, or if you've got clients suffering with lower back pain, the hip hinge can be an exercise that you can use to decompress the lower back if obviously done correctly. Now, as you can see here, I'm using a stick in front of me, which helps me, it kind of guides me down my leg. So I'm just kind of getting slightly below my knee. So if you think of a Romanian deadlift, the exercise itself, this is how it should be done in its original form. Now, there's a lot of people that would go further down because they would have a bit more mobility coming back or flexibility in the hamstrings. That's absolutely fine. Most people, on average, are kind of getting to about here, as I am. Okay, now this is absolutely fine, and the main thing that you want to keep in mind here is the position of the hips. So as you can see, I'm pushing my glutes back, and there's not really much knee flexion going on here. So we are going to talk about common errors, and in the common errors you are going to see some of the variations where there's more knee flexion, but here there is very, like, if there is any knee movement, is because the hips are pulling them back because of the connection of the hamstrings to the around the back of the knee. So the hip hinge is primarily a movement coming from the hips. So imagine having a belt around your hips and imagine somebody pulling you back. And what you're trying to do there, you're trying to push your glutes back as far as you can. And if you can have a look at my toes, you can see how they kind of come up a little bit when I push my glutes back. We are going to talk about the foot position in a second as well. But I just wanted you to see these kind of main points here. The other main point I want to make is the spine position. So as you can see, like, I start from a normal erect position there, and throughout the entire movement my spine doesn't change kind of its position at all. So just like with the knees, there is no spinal flexion, there is no spinal extension. My head remains exactly in the same position as I start, and that is because I don't really move. I don't really kind of focus on looking anywhere. You know, my eyes are just kind of just looking at a point on the floor, but I'm not really focusing. That's the whole point here. So you don't really want to focus on anything. You just want to kind of just keep your eyes open if you want to, but don't focus on looking at yourself in the mirror, for example, because that will bring your head up, and that will kind of ruin the whole symmetry of the exercise. So overall, the movement comes from the hips, starts from the hips, and then it ends with the hips. So when I push forward, that's when I squeeze my glutes. As I push through, there will be like a straight arrow on the screen. You're gonna see that here, and that is the direction that you wanna push your hips at. So you are, it's like a hip thrust, but you're standing. Okay, so this is literally how you should be performing the hip hinge. And now let's have a look at the foot position. It's very important that you understand these foot positions here. So there's two positions. The first one is the most conventional one and probably the best one to use. So it's the forward facing position, where my big toe is facing slightly inward, but my index toe is facing directly forward. Okay, I am pushing my knees slightly out so I can create a bit more glute activation, but the whole idea here is to protect the knees, is to engage your foot, because if your toes are pointing in this direction, the arch of the foot, which you can see here on the screen, is also going to contract. Okay, and as you can see this better, I mentioned it a couple of seconds ago about my toes coming up off the floor when I push my hips back, and that is because my toes are trying to stop me from falling backwards, and that is exactly the feeling that you want to get here. When you start doing these movements in an actual deadlift, you wouldn't get this because the weight in front of you is going to compensate for that movement, okay? But when you're doing it without any weight, it's normal for you to feel that your toes are coming off the floor a little bit. And now onto a bit more of an extreme foot position, and that is something that I learned years ago, and it really helped me engage my glutes, because personally I had a period in my life where my glutes were just simply inactive. I couldn't activate them in any exercise, and my back was taking over. When I started inverting my toes inwards like this, I really started to feel my glutes working, because you are really focusing the femurs to invert as well, so to internally rotate, which kind of opens up the joint from the posterior aspect a little bit. And performing a hip hinge whilst your toes are pointing inwards is probably one of the best things you can do if you also, like myself, are experiencing issues with contracting and activating your gluteus maximus. And obviously the movement here is going to be less because the hamstrings, unless you have pretty good hamstring flexibility, like for me it's kind of average, I'd probably say, and the range of movements in the hip hinge is not going to be as good as when I have my toes facing forward, but that's absolutely normal.